Hi, I'm Dr. Nguyen at First Smile Family Dental. There's a lot of question about topic about full mouth reconstruction. Today I'm going to spend some time to go over some of the questions about that and hope you get some more understanding about the concept of full mouth reconstruction. So full mouth reconstruction is basically to restore your whole mouth, whether you have severe cavity everywhere or, broken teeth everywhere, missing a lot of teeth. Basically your bite is not the normal bite anymore due to multiple reasons, either trauma or have you been grinding and clenching your teeth so much and breaking them, or you have a lot of cavity and you're missing a lot of teeth, or you are having a lot of cavity and they just start to breaking. Then you want to think about just basically restoring the whole mouth instead of just fixing one or two teeth. A good candidate for full mouth reconstruction is someone that have rampant carie, meaning you have cavity everywhere, every single teeth in your mouth, or your teeth just breaking like a lot of teeth, or you guys in the problem about clenching or grinding your teeth. And if you notice that your teeth was long and now it getting shorter and shorter, basically when you bite down is you don't see your teeth anymore, or you're missing a lot of teeth. So those are the good candidates for full mouth reconstruction. Different treatment options for full mouth reconstruction include 4 or 5 implants on the top or the bottom, and then you basically hear about the all-on X. So that is the same concept for the full mouth reconstruction for people missing all the teeth. The same thing for people missing all the teeth. You can also do a denture, upper or lower denture, or if you have a lot of teeth but they are very short or broken, you can also do veneer or crowns. Is basically top and bottom, all the crowns on every teeth to restoring the look and the function of all of them. So general dentists do qualify to perform full mouth reconstruction. We obviously need to do additional training to get more skill and knowledge about how to handle different cases. But at First Smile Family Dental, our provider are well trained for that. We have done many cases to restore your mouth back to normal condition. The process for that, you're going to come in for a initial assessment, basically a consultation. We need to do a scan, a panel scan of all your teeth, and do an exam, like a comprehensive exam, to make sure we evaluate every single teeth, and then from then we will see if you are a good candidate for full mouth reconstruction. Depends on what kind of treatment that you're looking for, and also different treatment come with different price range. Depends on what it is, and we will first have to do the evaluation, and then we can discuss about what the best treatment option for your mouth, for your teeth, and then from then we will plan for you to come in. For example, if you're missing all the teeth and you would like to do upper and lower denture, it requires multiple visits. We're gonna take some record. We're gonna have you come in, try in all the teeth, and then the lab will fabricate them and making them. So it does require multiple visits. If you are a candidate for someone that do veneer or crowns, up and lower, is basically just take about 2 appointments. The first appointment is quite long. Come in and we're gonna basically fix all the cavity. We take some 3D scan, intraoral scan, and send it to the lab. The lab will have that and fabricate all the veneer and crown. So the second visit, you will come back for the seating of those crown or veneer. That will be a shorter appointment, but that technically take about 2 appointments for that. If you're thinking about doing an all-on X to restore your teeth with upper and lower implant, that will take about a few visits as well. We will also need to wait for the healing of the implant before we actually put a permanent prosthesis or crowns dental implant crowns on top. So those require a little bit longer appointment for the healing of the implants. At First Smile Family Dental, we only do a nitrous, and we just kind of give you a normal numbing, and we give you some nitrous if you're anxious. We also give you some medication for you to take the night before and an hour before the procedure. With that, you will need a driver, and then you come in, we can give you additional nitrous. A lot of the patients are doing very good with that. It also depends on what kind of procedure that you want to do. For a upper and lower on-X implant, it will take about sometimes to heal from that. So the first week you will, after the implant is placed, it takes some time for you to heal from that. But after the first week, you should be back to normal. And then from then, it's just basically waiting for the implant to integrate with the bone. So it takes about 4 months into we're ready to give you a final prosthesis. For a veneer or crown, it would not take you too long to heal from that even. Typically, you come in to get them getting ready, fixing all the cavity. You come home with a temporary crown or veneer. Your gum may feel sore a little bit, but it takes maybe a day or so for the gum to go back to normal. As for the denture, it doesn't really have any healing involved because you're already missing all the teeth. Or you need to come in just to get all the record and things like that, try them on, and the lab fabricate once for the denture. Once we deliver the denture, the final denture to you, that is when you're gonna come back in multiple visits to follow up and have some adjustment, because when you're wearing them at home and you start eating with them, you may find there's some sore here and there, and we need to have some additional adjustments. We do provide post-op instruction for each different treatment option that you choose. Depends on what kind you do. If you're doing a denture, it's sometimes lasts you about five years or longer. Sometimes it can break and it can get staining or get old. Then you will need, and also your gum and bone kind of shrink down. Then you will need a new pair of denture. For crown veneer, you need to take good care of them because they can have cavity again. So you need to floss and brush and then come back for your cleaning routinely to make sure that they are clean, and then your dentist can check and make sure they are good. As far as the implant or on-X, you do need to basically come in once a year for the dentist to take the prosthesis out and clean your implant and then put them back. But majority of the case with the on-X implant, they last you very long. For the option of doing the denture, complete denture, most insurance does cover that because that's the cheapest option, and it doesn't require a lot of care. So yeah, most dental insurance will basically cover that. However, if you're talking about the veneer or crown, insurance will consider as aesthetic. So most of the time they will not cover it. As far as the dental implant or on-X, for the implant space placement, they do cover. But for dental insurance benefit, they also have a limitation of how much they pay per month. And so they only cover part of it. If you are a good candidate for a formal reconstruction, at First Smile Family Dental, we have a team that we can help you look at different payment options. These are not, if you're looking for crown veneer or like a dental implant on X, the cost is a little bit high. So there are multiple different payment plan options to help you, achieve your goal. So if you're interested and you think you are a candidate for full mouth reconstruction, welcome to call us at 253-785-7323 or visit us at our website, firstsmilefamilydental.com. To schedule a free consultation. I hope that I already answered most of the questions that you have regarding full mouth reconstruction. If you have any additional questions, feel free to give us a call or visit our website to schedule a free consultation. Our team happy to assist you to help you, regain your mouth with a normal function and a beautiful smile. Thank you.